I want you to do one thing for me. I want you to take your tongue. I want you to rub it on top of over your teeth. I want you to feel if you feel a little notch. If you feel a little notch, I want you to listen in on what I'm going to say, because that little notch is not going to stay little forever. That little notch is going to keep getting bigger and deeper. And if you don't do anything about it, one day you're going to be eating bread and it's going to snap right at the gum line. And now you're going to have a bigger problem. So you've probably heard it before. If you're going to the dentist regularly and you have those little notches, you've probably heard it before, because I used to tell my patients this. It's not recently, but I used to tell my patients this. When I saw those notches, I'll tell them, hey, you're brushing too hard. What kind of toothbrush are you using? And I'll tell them, hey, go buy a soft bristle toothbrush, start brushing with that, and everything is going to be fine. But studies have shown, and over time I've learned better, that this is not the cause. Because if you take a tooth, like an extracted tooth from somebody's mouth, take a hard bristle toothbrush and brush it every single day, over and over again, that tooth stays the same. It never chips and breaks. So that tells us there's a bigger issue. If you want to know what that is, stay with me, because I'm going to share that with you. And I also want you to know this so that you can fix the issue, right? It's easy for me to just say, hey, you're brushing too hard, go switch your toothbrush. A lot of people like that answer because it's easy and it's cheap, but that's not the true answer. So what actually causes the notches, the gum line, is basically your bite and how your teeth are coming together. So a lot of people, more than 50% of the population, actually our teeth don't come together correctly like they should. So sometimes some people have gaps between their teeth, some people they have crowding on their teeth, and some people their bite is just not, it's just not how it should be. So I tell patients it's supposed to be top, which is your top jaw, should be bigger than your bottom jaw, just like a jar. So when you close the jar, the top is over the bottom. Sometimes that is reversed. And so when that happens, it means that your teeth are not hitting on the long axis of the tooth, right? So it's just like a metal post that's in the ground. So let's just say this is a metal post or metal. If we bang on it, it's just going to go deeper into the ground. It's not going to snap and break. But let's say if I could bend this a little bit, and I start hitting on it, eventually on that weak point, it snaps and breaks. It's the same thing with your tooth. So if your tooth is angled this way, if you start banging on it, it's not hitting over where it should be. So over time, that part of it flexes, causes a little bit of chipping. And if you don't fix it, it's going to break. And a lot of people will come in and maybe say, hey, my teeth are sensitive, or can you feel this spot? And can feel like I can place a filling on there. But the issue is that if I don't fix the cause, when I place the filling, it's going to be a few months down the line, a few years down the line, it's going to pop off. And you're going to come back and say, hey, popped off, can we do it again? So now you're doing stuff over and over again. Or you're going to be like, hey, doctor, you messed up. Your filling sucks. It keeps falling off. But the issue is not that I messed up and I did anything bad. I'm not saying every dentist is great, but for the most part, that's not what's going on. What's going on is, imagine if you are sick and you just wake up, you start throwing up every single day, throwing up, and you just get anti-nausea, anti-throwing up medication, right? So basically it just suppresses that, but it never goes into your system to see what's causing that. So you're not doing anything. It's the same thing with your teeth. If you go in and just patch up that area, or you go in and get a crown and you get all those things, you're not fixing the issue. So it's just buying you time. But after that, whatever you put in there, if your natural tooth could fail, that means that whatever filling, crown, whatever else you're going to do is going to fail because you never went in and fixed the underlying cause. So, obviously, now that we know that the underlying cause is the bite issue, the fix is to go in and fix the bite. And we're looking at some type of orthodontic treatment. You're looking at either getting braces, or you can get the clear aligner, something like Invisalign. And that's going to go ahead and put your teeth, straighten them out, put them upright, fix the crowding. And that is going to help put your teeth where they should be. So now they're going to function and work together perfectly. And then after that, you can then go in and do the dental work, where you either putting a filling on there or you're putting a crown on there. And that's going to last a long time, because who doesn't want to do something and do it once instead of doing something over and over again? So what do you do? Say right now you have those notches. First thing, like I said, go get a dental exam. Let them take a look at what's going on. I know you may be sitting there and say, I don't want to get braces. I don't want to do Invisalign. It costs a lot of money. But one thing that I need you to understand is you're going to spend the money one way or the other. It's actually better for me that you don't fix your bite, because I know that I'm going to have a lot of dental work to do on you over the years, because you're going to pop that filling over and over again. Eventually, the tooth's going to get sensitive. We're going to have to do a root canal on the tooth. We're going to have to do a crown on that tooth. And it's just one tooth, remember. And this is going to happen to maybe 3 or 4 teeth or 5. So I benefit nothing from telling you this. So just keep in mind that it may be a bigger investment upfront, but it actually saves you more down the line. You're going to actually end up needing less and less dental work in the future. The other thing is, let's say maybe you're not ready to straighten your teeth yet, but you really have a lot of sensitivity. One thing that my patients have found a lot of success in is using Sensodyne toothpaste. I'm not sponsored by them or anything, but I'm just saying what I've noticed. You can use the Sensodyne Rapid Relief. There's one that says Rapid Relief on it, and people tend to see the sensitivity go away a lot faster. It's not one of those use it for 2 days and sensitivity is gone. With Sensodyne, you have to use it consistently for about 6 weeks or so. So just know that. And then the next thing, we talked about fixing your body using Sensodyne. The other thing that we do offer at my office, and some offices offer this as well, is going to be, you may not have heard it before, but it's going to be desensitizing the tooth using laser. So there are some lasers where you go in, do the procedure, and then the sensitivity goes away. So that's something that you can do. But like I said at the beginning, we do want to make sure that we fix the underlying. Because if we go in and do the laser treatment, we do the filling, we do the crown, and we never fix what's causing it, we're going to be just back in the same spot. So, like I said, it's not the toothbrush, it's not you being heavy handed with it, because imagine how could you possibly? So, most of the people, when you have notches, you'll notice that you have one notch here, one on the bottom, but not on every tooth. How could you possibly every single day remember to brush just this one tooth really hard and not the other ones? Not possible. So, that's what I wanted to share with you, just so you know. So if you have any questions on the notches or anything that I went over in this video, definitely feel free to comment below and I'll respond to you directly. And feel free to share this with somebody who may not know, because you never know who you're going to help and whose teeth you're going to protect your foundation. And I'll see you in the next one.